Now we're going to see the dihydropyridine and non-dihydropyridine calcium channel blockers. We're going to do the comparison. So the dihydropyridines are those that end in pyridine, like amlodipine, felodipine, nicardipine, clebidipine, felodipine, nimodipine. And the non-dihydropyridines are diltiazem and verapamil. Now, diltiazem also has the effect of dihydropyridine, more or less. Dihydropyridine acts on vasculature and non-dihydropyridine acts on the heart. Diltiazem also acts in the vasculature. So, these we already talked about them. These are antiarrhythmic medications and are used for some supraventricular tachycardias. Also for congestive heart failure, usually if the patient also has hypertension and or signs of angina. But if there is congestive heart failure with reduction of ejection fraction, there is contraindication of give these non-dihydropyridine calcium channel blockers, but not of this, and we can give this to the patient if the patient has hypertension. Now, all the dihydropyridines except nimodipine are used for hypertension, Raynaud phenomenon, and vasospastic angina, prismetal angina. Now, nicardipine and clebidipine are used for emergency or urgency hypertension. Felodipine and amlodipine are the only ones that do not have the negative inotropism. All the others have decreased the inotropism, is decreasing the heart contractility. Amlodipine is one of the most common drugs used as an antihypertensive medication. The dose is not more than 10 milligrams a day. And felodipine also is used as antihypertensive medication. Now, nimodipine is used for subarachnoid hemorrhage. That is, after the subarachnoid hemorrhage, the blood and all that inflammation leads to a vasospasm of the arteria. These vasospasms would present again with focal neurological symptoms. So in order to prevent this vasospasm, we give nimodipine. So after this subarachnoid hemorrhage, we need to give nimodipine, because if not, 4 days later the patient would have focal neurological symptoms. Now, the adverse effects include edema, flushing, constipation, mainly for verapamil. The only calcium channel blocker that produces hyperprolactinemia is verapamil. And also there is gingival hyperplasia. There are other medications that produce gingival hyperplasia, that is phenytoin and calcineurin inhibitors, specifically cyclosporine. Alright, so the dihydropyridines are mainly used for hypertension and the vasospasm in subarachnoid hemorrhage, and the non-dihydropyridines are used as antiarrhythmic medications. And remember, the treatment of overdose is with glucagon.